In the early 19th century, morphine, an incredibly useful analgesic or painkiller, was derived from opium. Since then, we have studied the structure of morphine and created many synthetic opioids, such as hydrocodone, fentanyl, and oxycodone. As a result of the increased availability of prescription opioids, opioid abuse and addiction have become a global health crisis. This problem affects millions of individuals around the world and has hit the United States particularly hard. According to the CDC, from 1999 to the present, the number of opioid-related overdose deaths in the U.S. has quadrupled. With the problem worsening, it is very important for us to understand how these chemicals affect our bodies and more specifically the brain. So first, let's backtrack to the 1970s when a couple of key discoveries were made. In the 70s, scientists found peptides in the brain that had very similar chemical structures to opium. Due to the resemblance of their structures, these newly discovered chemicals were understood to play a role in pain relief. Down the road, as different peptides were discovered, they were grouped together and named endorphins. Endorphin coming from the words endogenous, meaning internally originating, and morphine. Essentially, endorphins were understood to be natural painkillers. At about the same time, opioid-specific receptors were identified in the brain. There are three classic opioid receptors: mu, kappa, and delta. These receptors are dispersed throughout the central and peripheral nervous system. Receptors can be found in the spinal cord, brainstem, limbic system, and cortex, just to name a few areas. Each of these receptors responds differently to different opioids. For instance, nalbuphine, a painkiller used for surgery, inhibits mu receptors and activates kappa receptors. In addition, the activation of different receptors can cause varying physiological responses. While opioids and their receptors are most commonly associated with pain relief, other responses include respiratory depression, euphoria, hypothermia, nausea, constipation, tolerance, and physical dependence. Now that you know about opioid receptors and endorphins, let's finish off with talking about what all this has to do with addiction. Addiction formation is most associated with the reinforcement circuit. The reinforcement circuit includes a number of structures such as the ventral tegmental area, or VTA, nucleus accumbens, hippocampus, and amygdala. The activation of mu opioid receptors in various structures of the reinforcement circuit has proven to play a key role in drug reinforcement, which can eventually lead to addiction formation. As stated previously, activation of mu receptors can be caused by various prescription opioids and illicit substances like heroin. Ultimately, as the opioid epidemic grows, it is vital that we have an understanding of how opioids can alter our brains. And hopefully, through this video, you have gained some knowledge about these chemicals, their receptors, and how interactions between the two can lead to a number of responses ranging from pain relief to addiction.